Well, that's a decision that I had to give you an answer based on an uncertain knowledge about that. Is Cornish going to establish that its employees and students need to comply with the policy on public property? Are they going to go there and then have the threat of somebody bringing a lawsuit and say you can't do that? I've seen boards define, my own institution, our Board of Trustees defined the campus as including sidewalks on non-vacated public streets, and even the public streets themselves, because we had students standing out in the street smoking, saying it's not your property. And we had the board define that that's what the policy applied to, was within this boundary, or these boundaries, our policies apply to college students and employees. Now, that could be contested in court, and we might lose. But never was contested in court. Threats were made, never was. So again, I've worked with institutions that have had that problem. I mentioned to you yesterday when we chatted briefly of the Portland Community College system. Have several downtown campuses. They also have some more suburban campuses, but you might be looking at some of what they've tried to do. I do know of a few cases where institutions have gone to the city council or the city government group and asked for a codicil in the law that allowed them to establish the policy, make the sidewalk adjacent to X institution tobacco-free. That is another option. There's no perfect answer to the question of what about these public areas. There's no perfect answer, but we do need to try to address those questions in advance with our students and our employees. It needs to be on our website. What if I'm on such and such sidewalk that's not school property? And then the answer has to be whatever the answer is.
Well, so, you know, I'm not trying to play too much devil's advocate here, but I had great conversations with Portland Community College where a big issue became for them that people started clustering in the sidewalk
Sure.
right out front of the Portland Community College sign.
Yeah.
Right? Because now they're off campus, but the first thing that outsiders are seeing are this cluster of smokers. And that sidewalk issue is a huge deal.
Yeah. And there's
you're
no...
You're not going to your city council and having that done in the 1 year it takes
No,
to do a policy.
no, you're not.
So, like,
No.
it's a little bit complicated.
It is complicated, and if I've done anything to suggest to you that it's not complicated, then for gosh sakes, I've done a terrible job. The issues are extraordinarily complex. But let me say this, those issues don't defeat you. That's the point I want to drive home most of all, is there's always a way to try to respond to things. One of the things that I recommend is an institution that's going to adopt a policy in that year of time, and it may need to be more than a year, Amanda, but whatever length of time they have, one of the things they do is communicate with the neighboring businesses, neighboring residential areas to say, we're in the process of adopting a tobacco-free or smoke-free campus policy. It will go into effect such and such date. We are going to hold some meetings for you, and we'd like you to come to the campus. The president or chancellor should be directing this letter. But in addition to that, teams, volunteer teams who go through a training and are given some literature, go door to door and talk to people about the policy in advance to say, we're doing all we can to educate our students and employees not to come off of our property onto yours. But we know historically this can happen, and so what we want to do is let you know that the number to call, the office to contact in the event that should happen. It'll be our worst outcome if we have people doing that, because we're basing this on respect for others and the environment, and we're hoping that in our communication with our staff we're driving home the message that this is the most disrespectful thing you can do. To go stand on a sidewalk in front of someone's home and smoke? Crazy. But medical staff at medical centers and hospitals around the country that have implemented these policies have people going onto those properties and doing that all the time. Yes?
I know I was late to coming today, but have you addressed the idea of having cessation support during the time of these transitions?
I haven't, but it's essential that I recommend any organization that wants to undertake a smoke-free or tobacco-free policy needs to be concerned about the impact of that policy on people who use tobacco. So both students and employees should be provided cessation therapy, NRT, to get through the day. They should be helped in every way possible. Furthermore, supervisors need to be trained about how to talk to their employees. Advisors need to be trained about how to talk to students. people that advise student groups or work with student groups need to be talked to about how to talk about the policy and what the issues are there. Just assuming that people are going to be able to figure out what to do and what kind of cessation devices are available and where they go to get that help is not an effective thing. Or just directing them to the website is not sufficient. You've got to actively engage with people. So to do that, we've got to actually teach people how to actively engage. It's not complicated, but to assume that every supervisor will sit down one-to-one with their employees and say, we've got a tobacco-free campus policy coming into effect this fall, what are you going to do? I think you smoke, or I think you chew, or whatever. How can I help you with that?
Do you have any success stories or studies that show a better success in achieving this tobacco-free, smoke-free campus policy with cessation services provided on campus during those times of transition? Can you direct us to?
No, I wish I could do that. As a matter of fact, one of the areas that we're really lacking in is research on the impact of the policy on smoking and chewing behavior. And part of the problem for that is, and most of you know this, is we have very poor baseline data. We don't know how many of our students and even our employees use tobacco. It's a very imperfect baseline or a set of data that we have. That's a tricky thing. Then it becomes difficult to measure impact also for similar reasons. How do you know that you're getting the right information from people? I mean, ultimately you have to rely on them telling you how the policy has impact, or what their behavior is. So it becomes difficult to do. And the other thing is there hasn't been a lot of time that enough institutions have had these policies in place to really measure impact on actual tobacco use. Now, to your question of, is there evidence that having cessation actually expedited policy accomplishment or expedited?
Available on campus.
Yeah.
For both
The only thing I can speak to with authority is it's been very surprising to me that as few numbers of people take advantage of the cessation programs and services that are provided when institutions implement policy. It's been crazy to me because it's very small. It's much smaller than most people anticipate. There's always been a concern about cost of that. So on one hand, you're able to say to people, well, the cost won't be as great as you think it is, because although we'd like more people to take advantage of cessation, they don't. But we also know that there is cessation services available through a variety of sources, and we promote those or recommend they be promoted, like the LA's online program, where you can go online free of charge, and there's quit lines in states that provide all kinds of assistance. So how many people are taking advantage of those kinds of cessation programs independently of what the institution might provide? We have no perfect answers to that. Yes, sir.
She had mentioned that when you have your students cross the public sidewalk,
Yeah.
if they start smoking around a business, then you
Yeah.
give them a number to call.
Yeah.
Our street, they don't have jurisdiction
Yeah.
across the street, so what number do you give them to call?
Well, that's a good question. You got to decide in advance. First of all, you may not want to do that. You may not want to go there. You may want to say, well, that's not our jurisdiction, we can't control that. I like the idea that you're going to be talking in all your orientation sessions about our policy and about it being based on respect, and you're going to be expected to not go on other people's property and be a bad neighbor for us, because that really hurts our image with our neighbors, and it isn't something that we want people to do. So we expect you to not only to comply with the policy on our campus, but we expect you to be respectful of our neighbors and not go across the street and smoke in front of a convenience store or a grocery store or in a residential pop area. And if we're going to give those people our dean of students, our safety and security people, public information officer, their telephone number, and we're going to try to find out when this is occurring and go observe and see if we can identify who's doing this so that we can talk to them about why they're choosing to conduct themselves that way. I mean, it's not perfect, and again, you may decide, ain't going to go there. I'm not saying that's a perfect solution.